President Navroz, fellow Rotarians, ladies and gentlemen. It gives me great pleasure to introduce Dr. Sitesh Roy, a highly qualified medical practitioner who combines various life sciences into a holistic treatment for his patients. Let me begin with his impressive medical background. Dr. Roy is MD Pediatrics with super specialization in adult and pediatric allergy immunology. He's a diplomate of the American Board of Allergy and Immunology, a fellow of the American Academy of Pediatrics, of the American Academy of Allergy, Asthma and Immunology, and of the American College of Allergy, Asthma and Immunology. He was voted amongst the best doctors in America for 5 years, most recently in 2011-12. Now, of course, he has settled down here for 2 years after having lived in the US for 14 years. Dr. Roy combines his medical knowledge with ancient Indian wisdom and comes up with cures for his patients and not only control of symptoms. He has further honed his inborn talent and taken on the role of not just a conventional doctor, but a personal and family counselor, a health and wellness expert whose patients are not just sent away with a prescription, but made to understand the essence of health and the root cause of their problems. Dr. Roy, as I said, has been here just for 2 years, so I need to just talk about the types of patients that he has been involved with. He is personal medical advisor to ministers, senators, and rulers of various countries around the world. His clientele include HNIs, several NRI families of Indian and Asian origin living in South Africa, Canada, US, and UK, many well-known celebrities, industrialists, and corporate CEOs. And humbly, and last but not least, he has done wonders for the health and well-being of my family and I. Well, I now pass on the floor to Dr. Roy, who's speaking on the interesting and perhaps, given the number of doctors in the audience, controversial subject of curing incurable diseases naturally. Dr. Roy.
I would like to thank Mr. Ali Merchant and the Rotary Club of Bombay for inviting me today to come and speak to this wonderful audience. It really gives me great pleasure to speak about something that is so close to my heart, that has really been a passion for me since I was probably in the early stages of my medical career almost 24 years ago. Having gotten into the field of medicine with the idea that we help people, cure people, get them better, to tell you the truth, I was fairly disillusioned very early in my medical career when I figured out that we were spending very little time with patients. We were mostly running after getting the symptoms under control. And these were not because we chose to do that. It was because this is what time and with regards to the availability of the patient, if I may call it, and of the doctor, and of the services that we were provided with. And so it really started getting me to think that in medicine, especially in allopathy, which I chose to become a super specialist in, putting in about 13, 14 years of training, whether really I'm doing a service to the patient, which I felt I was, or is there more that I could do to them? Because many of them came with the intention of wanting to get totally rid of their disease. And what I was primarily doing for them was giving them control for their disease. It was almost like I was giving them, they came to me in a handicapped state. I used that word a little, it's a strong word. But I was using it, they were coming to me in a handicapped state, and instead of figuring out which nerve or which muscle or which bone or which structure in their body is not working right because of which they are handicapped, I was trying to find the best wheelchair that I could give them. And I used to give them the wheelchair and they used to go away happy, but really they weren't independent, they weren't free. They weren't able to live the life that they envisioned for themselves. And when I started to think about it, I realized that I was looking at a very superficial aspect of medicine, the physical disease. And that's where my talk actually begins, is that the word dis-ease, the loss of ease in the body, it's a loss of an equilibrium, of a homeostasis, as they call it. And when you look at this disease, before it manifests on the physical level, there are many signals, many red flags that the body gives to the person, which one, the patient or the individual does not realize, and two, by the time they get to the physician, it's probably too late, or a lot has already happened. And when we look at any disease today, when we look at modern medicine, the way we are looking at disease, every single disease is now tied into environment and genetics. And when we look at environment, that includes all the stressors that we put our body through. And stressors are many. People think of stress only as mental stress. There's physical, chemical, emotional, mental, psychological, spiritual stress also. And when we look at the stresses and the imbalances that they create in the body, the loss of the equilibrium, the homeostasis that we are talking about, it's after that there are chemical derangements occurring in the body, and subsequently the disease, after many years usually, manifests at the physical level. Now, when you look at coming back to my own field, in the field of allergy and asthma, India used to be very low on the list of these diseases in terms of its incidence and prevalence. But in the last 20 years, because I've been coming back almost every year since I went to the US and interacting with my friends, colleagues here, it has been amazing to see how the rise in trend in allergies and asthma in India is mirroring what was seen in US, UK, Canada, New Zealand, Australia 20-25 years ago. It's literally following the same track. Younger and younger children with problems, people without previous history suddenly getting down with the disease, and all because of immune imbalance, immune dysregulation, loss of a homeostasis. Now, if you look at this disease, there are very good explanations for it, but when you look at the underlying principles behind it, we really still don't understand why that immune dysregulation. Some blame it on our diet. We are getting more westernized in our lifestyle and our diet. Some blame it on stress. And there are very good studies from all over the world that suggest, yes, these are connected. But it still does not give us that holistic approach as to why this is happening. So when we look at a disease also, we come to realize it's not just a physical thing. There is a mental, an emotional, a psychological, an astral, an ethereal, and then a spiritual component to disease. Much of which I realized that as a busy practicing physician, whether it was in the US or it was here, I don't always have time to delve into. And when I can't delve into that, I really can't get to the root cause of the problem. So I'm left with controlling the symptoms. And as a physician, I wasn't satisfied with that. I felt that I was shortchanging both myself and my patients. So at that point of time, I decided what really needed to be done, and this was probably when I was hardly a few years out of my medical training and practice, was to look at a more customized and individualized approach to medicine, which is very interesting because now modern medicine is finally going that way, where we are realizing that if there is one drug which we have done all the FDA-controlled trials on and released into the market, we learn a lot more about that drug after it has been used by a few million people. We come back and we realize there are problems. We come back and realize that not everyone responds to that drug the same way. And that's where the entire field of pharmacogenomics and proteomics comes into play. So even modern medicine is realizing that there needs to be individualization of our medical therapies. Each individual is unique, that the same aspirin won't do the same thing in each one's body. And that, I think, was an art and a science that I found served me well when I started applying it to my patients. And so I realized that rather than being a doctor, I was very used to doing this. People would come in within the first 3 to 4 minutes, I would know what their problem was. And in the 5th minute, I could write them a prescription and send them on their way. And they would consider, especially in my field of allergy, asthma, immunology, where results are quite fast, they would think that, I was close to God. Whereas I knew that if they were stopping the medicines after a few months or a few years, they would be back to square one. Now, in my field, there's an additional therapy where we desensitize people to what they're allergic to. That's a fascinating treatment where a person can't have a tiny piece of a peanut without going into full-blown anaphylaxis and almost dying. We can now desensitize them where they could have a whole cup of peanuts and not fall ill. But still, it's only to one agent, and I still don't know why that person's body became so hyper-reactive to a food that it should have learned to ignore and tolerate. And what was it that was imbalanced in their mind, in their spirit, in their system, emotionally, psychologically, spiritually, that they chose, their body chose, their immune system chose to react to it so violently? And that's when I started sitting down and counseling patients, because I realized that this was an art that was very much there in India thousands of years ago. People would go to a Ved, to their family physician, who would sit down, listen to them, not always for very long, but the person would have some time to pour out their heart. And many a times without any medication, by the time they left, they were already feeling better. The art of counseling. I realized that this was an invaluable art that has helped me get to the root of many problems that superficially, even modern medicine today, struggles to find. You name a disease, and you will find that this holds true. And within these diseases, I just was reading the front page, the talk that you all recently had or will have in the near future on cancer and how be afraid, be afraid, be afraid. On the other hand, I would say that fear, stress, anxiety, frustration, depression, we don't have medical tests for these things. But these are wreaking havoc in our immune system. And the immune system is ultimately the final mediator for any disease. Right from a heart attack, to a damaged joint, to allergy, asthma, to gastrointestinal diseases, in every system. And so recognizing that when you get a chemical or a physical or microscopically, we even don't know down to the receptor what is going wrong, we can go and try to fix that receptor. But nobody asks, why did that receptor become dysfunctional? All we know is that we blame it on genetics. The person was born with it, or they had a mutation that caused it. But if we are to look at it more closely, more carefully, we would realize that there are certain aspects in that person's diet, in that person's lifestyle, in that person's thinking patterns, behavior, actions. If you would go even far back, for those who are believers, karma, past lives, which make them come into that situation where they have to face this in order to come out of it. And what do we do as doctors? Come in with a headache, here's a painkiller. Come in with an infection, here's an antibiotic. Come in with depression, here's an antidepressant. Antidepressant makes the person feel that there's absolutely nothing wrong with them. The moment they stop the antidepressant, they know that there's something seriously wrong with them. And I'm not saying that there's anything wrong with doing this, because not everyone that I meet has an inclination to go to the root of their disease and try to figure it out. Some of them are happy with symptomatic control. That makes out about 85 to 90% of my practice. But the remaining 10 to 15% who are willing to wake up, come into that awareness, recognize that disease or the symptoms that they experience is a red flag. It is a beginning point to tell them that something is not right. Find the root of it before it becomes a permanent disease. And I would even go to the extent that in our experience, in our treatments with the team that we've generated and created using multiple modalities of healing from around the world, combining them in a way that works best, whether it's with our team of counselors, whether it's a team of healers, it's a team of people who are into diet and nutrition in a very deep way, combining ancient and modern knowledge. We are able to take on cases where people come in already with existing diseases. And when we sit down and we understand what they are eating, drinking, what they're doing throughout the day, what is it exactly that drives them? What is it that exactly pulls them down? What is it that they are facing? We are able to counsel them, guide them, give them options and solutions so that they can not just be dependent on a medication for the rest of their life that will make them feel that they are okay, but rather identify the root cause and eliminate it. And that is what I mean by curing incurable diseases. Now, having said that, I would take this one point further and say that under ideal circumstances, cure begins before the disease starts. The problem and the solution come together. And so if we have that awareness about what is going on in our physical self, in our mental self, emotional self, psychological self, and are able to act upon it soon enough with someone that we can trust, someone that we can believe in, something that we have faith in, it is possible to sometimes eliminate big diseases before they occur. And that's what preventive medicine is all about. But how do we do it? We do it with tests. Now, you can't do a test for someone who's feeling sad. But it has been well connected now that if you stay sad for long enough, your immune system is going to become dysfunctional. You're going to end up with allergies or with rheumatoid arthritis or with some other disease. And imagine the beginning is sadness, depression, being low. And so when it comes to curing incurable diseases, it becomes important to first pick up the signals before they occur. And if they've already occurred, to recognize that a pill, a prescription is not the answer. The answer lies in finding out the root or the origin of the problem. And this journey has really led me to some very amazing healing sciences, many of which originate in India, which have unfortunately been lost over time or been mispracticed to the point that they've gotten a bad rap, a bad name. But with a little bit of effort over the last 15 years, it has been possible to find people who still understand it, do it in the right way, and apply it in such a way that major diseases, whether it is hypertension, whether it is diabetes, whether it is blocked arteries, whether it is renal dysfunction, many things can be taken care of. And sometimes it is as simple as changing diet and lifestyle. Now, I'm saying it's simple, but it is not always simple, because it takes discipline when you go into that. And that's when I say the difference comes in between the 85% of the people that I treat who are saying, no discipline, just get me better, and the other 15% who say that I'm willing to take what it takes to get back to what I was before, so I can live completely happy, satisfied, independent life, not dependent on medications, pills. And I'm not saying again that as a physician I don't do regular medical practice. I do in multiple places across the world. I travel all over Southeast Asia, all the way to Europe for lectures, conferences as a medical advisor to several companies, pharma companies doing medical research. I still do all those aspects of my life, but I have come to realize that if a person is willing to awaken at whatever stage it is in their life and with whatever diseases that they have, there is a way to some extent, and I'm not promising, when I say the word cure, it's a very big word, you know. It is very much possible to come out of these issues, or at least have a better understanding of what is going on. And once that better understanding happens, often the healing happens right after that. Knowing the problem is the first step to healing the problem. And many times we don't want to know the problem, we want to just cover it up, make it go away. So having said that, in essence, what I'm saying in this short 20 minutes that I've been given to speak here today is that when it comes to curing an incurable disease, any single pathy, and I am speaking as an allopathic practitioner, no single pathy I have come to realize has all the answers. Whether it is homeopathy, allopathy, you name it, anything else, Ayurveda or any other field or science, in today's day, because our lives have become very complicated. We have 50 to 100 times the stress that we did when these sciences were first founded. And in order to understand this and make modifications or changes is very much possible. All that's required is having someone who has the knowledge, the understanding, the patience to delve into this, to find the root cause and eliminate the root cause so that we can come out of a disease. Now, in the steps that we follow for patients who come to us, there is generally a stage in which we have a very detailed intake on all aspects of the person's life, followed by certain specific investigational techniques that may combine modern medicine and ancient medicine, following which there are multiple counseling sessions in which the disease is broken down, it is teased out, literally like a surgery is being done, but only at the level of a mental, psychological, emotional, spiritual and astral level. And when that is done and the person is open and willing to transform, disease often disappears, sometimes without medication. I must say, I've been amazed at the ability of the human body to regenerate, recuperate and renovate itself. It is just fascinating. There is no other thing on the face of this earth that can do that more than the human body and mind. And so having said that, I shall, I think I've used up my 20 minutes and I shall open up the stage for any questions that anyone may have regarding what I have just spoken about.